Welcome back. With school in session and more places reopening, it's important to take a step back and know where our state stands right now during the pandemic. To do that, we need to take a closer look at the numbers, and our 9 Health expert, Dr. Payal Kohli, joining us right now to help us understand that data. Good morning, Dr. Kohli. So we've seen so many of those photos of college parties across the country. As for Colorado, is it college-aged kids that are mostly comprising these new cases?
Good morning, Natasha. Yes, in fact, that is very true. So not only are we seeing outbreaks on college campuses, what we're seeing is that college-aged kids from the ages of 20 to 29 represent the largest proportion of new cases here in Colorado. So if you look at this graph, shown in gray is what proportion of the population that age group represents, and shown in the colored boxes, you see what proportion of new cases that age group represents. And you can see that it's really the young kids, 20 to 29, that disproportionately represent almost 22% of the cases, whereas they only account for about 14.7% of the population. And you can see that also in the slightly older age groups, 30 to 39, 40 to 49. But what's very interesting about this graph is as you get older, you can see that, there are fewer cases, and that's not occurring because the virus is behaving any differently in the older population. It's likely occurring because of behavioral reasons. The older people are less likely to get together. So I think the fact that it's shifted into the younger population has made it a little more challenging to track the disease, because these younger individuals are more likely to be asymptomatic, less likely to get tested, and it may spread more because they're more likely to congregate.
As time has gone on, we've slowly been expanding our quarantine bubble. Restaurants, workplaces have reopened. Has this had an impact on where the outbreaks are happening?
It's a very interesting question. It has indeed really changed the demographics of where the outbreaks are happening. So if you look back to April, you saw that greater than 80% of the outbreaks occurred in nursing homes, with a small proportion also occurring in prisons. But if you look at the distribution now, in August 2020, we see the majority of the outbreaks, 20.4%, have occurred in bars or restaurants or entertainment places, with only 15.9% occurring in nursing homes. And then, of course, you see representation of all the other things that we're doing, social events, going back to work and being in the office, retail places, and schools as well, all representing some proportion of the outbreaks. But the overall height of the bar in August is shorter than the one in April, which suggests to us that, we're washing our hands, wearing masks, keeping social distancing is working to reduce the overall number of cases. And this is okay, because as we expand our quarantine bubble, we are going to see outbreaks occurring in other places. But I think the point here is really to understand that even if we sit outdoors at a restaurant, follow all the precautions, it still, does expose us to some risk.
Yeah, but that is encouraging news. And Dr. Kohli, you've talked a lot about antibody testing. So what percentage of Coloradans doing those kind of testing is coming back positive, and how does that compare to other states?
Here's another really important question, because the positivity rate on the antibodies tells us how far we are from the herd immunity threshold, which is about 60 to 70% for this disease. So you can see that our 7-day average for antibody rates is 7.2%, which puts us at about average compared to the rest of the country. On one end of the spectrum is New York, which is very high at 10 to 20%. On the other end are states like Utah, which only have 1 to 2%. But really what I want to point out here, Natasha, is the shape of the antibody curve. Now, what you would expect is the antibody positivity rate to be going up in parallel with the cases going up, because as people get the virus, recover, they should have antibodies. But the fact that it's flat tells me that some people are losing their antibodies over time, which some studies have shown us can occur.
All right, Dr. Kohli, thank you so much for joining us this morning.